Good morning, doctor. Please introduce yourself to us, sir.
I am Dr. Mohammed Ali. I am a chief dental surgeon for Ayesha Dental Clinic, which is located in Shivaji Nagar in Bangalore city.
So, how long have you been associated with the company and the product, sir?
I have been associated with the company from past 3 years, more than 3 years I can say. And for the product, Turbodoc Solutions, I am associated for about 1.5 years.
What was the main obstacle that prevented you from using the product initially, sir?
Initially, the obstacle would be for online appointments were there. For that purpose, we needed an internet connection. So the internet was not available as the broadband was not there. Only pen drives were available. It was not a normal modems were there. So the speed was an initial hurdle.
Okay. After that, it was
okay.
Great, sir. Which specific feature of the product did you like the most, sir?
I like about the main SMS center, which keeps informing the patient about their needs, their appointments, all those things. Because from the SMS we can keep even the patient as well as the doctor can schedule their own appointments in a busy schedule. Even the consultants were informed clearly about it. They had an appointment and what patient they are seeing, about it, what time it's available, whether the appointment's been double confirmed. All those things, the SMS was a very much keen and it was a good tool for the consultant.
Basically, other than SMS, anything else?
SMS is a record, maintenance of the records. Records in a sense, patient's history is there, chief complaint, whether he's allergic to some medicines and patient whether he's medically compromised, what precautions we need to take about doing dental treatment. Because most of the dental treatment patients are very much apprehensive. There's a lot much of fear there involved. They don't want to see a dentist. There's a little more of an ambiguity there whether we need to go to the dentist or not. So, because one visit, I cannot repeatedly asking patients whenever they come down to give us a record. But once the patient comes down in an operatory reception here, the records have been on a written pad first. It's been taken down, then put it onto the comp using a Turbodoc solutions. It is very much hassle-free. When the patients come down for the next visit, it's on just a click of a button. We get a good history of it. Why the patient has last visited, whether she has got any diabetes or hypertensive, or whether he's taking, for example, cardiac open heart surgery is done, so he'll be on some drugs called as an ecosprin, whether we need to stop before the procedure, after the procedure, any special precautions. Medicinal allergies involved wherein patient has to be, some medicines have to be avoided. Those things is a very much great. Click of a button on a monitor which you can just check it out. This patient doesn't know, these drugs are not suiting his body, so we need to go about it with the other line of treatment. Everything changes there.
How would you rate the overall post-purchase experience, sir? How would you rate the post-sale experience?
Post-sale experience from about 1.5 years you're talking about?
Yes, sir.
I would give it, for the rating of 10, I would give it about 7.
Okay.
3 more stars have to come down to that.
Okay.
Because when the product was launched, associated with the Turbodoc initial stage, the rating was 3 over it. I am putting now at 7.
Okay. Okay.
I had earlier also told
yes,
you that about it, the rating is 3 over it.
Yes, sir.
We need to, it's 4 have improved in 2 years. Good, that is good.
Great, sir. So coming to the point that you mentioned about the usability of the product by the front desk person, how easy has Turbodoc been to use by the front desk person, sir? By yourself and the front desk people?
That's what I'm telling you. Now the rating goes from 3 to 6 only. I'm telling you. I'm making 1 point less. From initially it was 3, very much harder enough. Now the rating has gone to 6. Still more. I want it to be more friendlier about it.
Yes, sir. That's right. But let's take another example, sir. When compared to other products, if you have seen, how do you compare it to Turbodoc, sir? I mean, in terms of easy to use and feature set, etc. How do you compare our product with the rest of the products available right now?
See, the rest of the product which is available here, I don't want to mention the product's name. There are, I know about it, I have got in my systems also about it. There are one-time purchases, software also are available, online software also are available about it. But when you compare to nothing like Turbodoc, but there are much, mostly I will say it is it's a customized product or a tailor-made thing. Other things and all are not like that. They have got the specific requirements. We need to squeeze things and we need to do it. Okay. Here, one good thing about the Turbodoc, they take a feedback of doctors, what you need to incorporate, how your thinking is there. Those things are very much good enough.
So So, do you find any other usefulness of the product that you want to explain, sir? Anything else that you use the product which has been helpful for you, apart from the SMS and the records?
SMS records is there. Accounting is very much helpful
Okay.
about it. We can keep the track about it, the expenses,
Okay.
both incoming as well as outgoing. Whatever the clinic records requirements are there about it.
Okay.
And disposables. Everything has been on record now.
Okay.
Previously, we need to have jot it on a separate books, make it as every monthly we check it out. But it's a click of a button we got it. As well as I access on my laptop, mobile, everywhere. One good thing about TurboDoc is as far as I was on the move here in my location, I was able to access my clinic records, what is going on there, how much is happening, everything.
Regarding your friend circle and others, sir, how are they been using the product? How many of them do you know personally who have been using TurboDoc? What do you feel? What are their feedback to you?
I personally know about most of at least 4 or 5 doctors which friends are there. Dr. Gurudev
Okay.
and from what do you call I don't one more thing Smile Affairs. One more doctor is there. Two affairs.
Yes, sir.
Dr. Rashmi is there. She's been using over it.
Yes, sir.
And one of my mentor from Chennai, Dr. Muthu is there. He's been using very regularly. So those people are very much, they have liked the product, and from being from Bangalore, being from the Karnataka state, so the product has gone to Chennai, from throughout India it's slowly moving on. Good signs of
Okay.
growing it.
Okay. Great, sir.
Being from a doctor fraternity, from a medical background, we cannot promote a product. See, here, according to the medical ethics also, you cannot do an advertisement. Other people's, for example, Batras and all, for homeopathic, they are doing it. But officially speaking, according to the medical council rules of regulation ethics, no doctor has a right to promote their product. But they can promote their practice in a sense where the one thing which TurboDoc was there by using it, I liked was the SMS, because you will be able to reach the patient, and most of the patient can keep up an appointment, and they liked that was the most responsiveness for it, because now the trend is like that. Everybody is having the phones, they are accessing about it. They missed out any appointments. Otherwise, they want to reschedule the appointment. For them, it is very handy. Even for us, it is a good response. Some patient who has not been able to make up at least half day long, he's got an appointment in the evening, morning only he calls up and reschedules the appointment. Otherwise, he's asked for other postponement of appointment.
Yes,
That's
sir.
a very thing, because in today's fast world, that is a very catchy thing,
Okay.
which I like most for
Okay.
this one.
Okay.
Other products, other things are there, but this is the
Okay.
main thing about
So,
it.
so which are the other 3 benefits that you will put for the product, sir? What are the other 3 benefits you got from the product apart from the SMS?
Hassle-free maintenance of records.
Okay.
Put it as a paperless office also, and as well as I can in one go keep everything of the patient record, from photographs till X-rays.
Okay. Okay. How addictive do you feel TurboDoc product has been, sir?
Addictive.
Yes, sir. Do you think that tomorrow, if the product would not be there, would your practice be affected, sir?
Surely. We are now totally moving from paper to paperless office.
Okay.
It's slowly moving on, because we don't want any interferences again from that thing coming
Okay.
out.
Okay. And in that sense, also you feel that TurboDoc has been trustworthy and reliable.
Yeah,
in that
reliable.
Okay. Thanks a lot, doctor. We really thank you for your feedback, and we really appreciate your honest and good suggestions. We will definitely incorporate them, sir. Thank you.
Please